Hello everyone. We are presenting on the Beveridge healthcare system. We will begin our presentation by describing the characteristics of the model. The Beveridge report was written in 1946 and led to the creation of the Beveridge healthcare model. The Beveridge system operates as a single-payer, single-provider system in which the government controls what services and compensation healthcare providers deliver and receive. The system is funded by taxation of the general public, and patients are not charged out-of-pocket fees as healthcare is deemed as a basic human right. It is a system that is managed by the creation of a centralized governing body. In the UK, this system is known as the National Health Service. All citizens are guaranteed the same access to care as government assumes the duty to fund and pay for healthcare services in the country. In 1948, the National Health Service, or the NHS, was established in the United Kingdom. Healthcare was deemed to be a basic human right, and the general practitioners were the so-called gatekeepers to healthcare services in the UK. In the 1980s, the first real reforms of the model were introduced. There was concern about the financial solubility of the NHS system. Performance indicators were introduced to see how different authorities were performing, which led to longer wait times for medical care. In 1991, a new structure was formed where doctors, the general practitioners, were the fund holders, and health authorities or trusts were given budgets to buy health care from providers such as hospitals and other health organizations. Any leftover profit was used for the benefit of patients and to improve care for the population. The budget was essentially decentralized at a more local level. In 1998, Tony Blair sought to reform the NHS. The public did not like the new structure formed in 1991 and had problems with the model as they sought less competition as they wanted to move away from hospitals competing to sell their services to GPs to a more collaborative model. They formed 6 new oversight agencies, including the National Institute for Clinical Effectiveness, which assesses clinical and cost effectiveness of drugs and medical procedures, and the Commission for Health Improvement, an investigative agency that assesses the performance of different NHS agencies. The quasi-market was abolished and oversight agencies were introduced. Wait times also decreased in this overhaul and actual number of visits to GPs decreased. The Health and Social Care Act of 2012 led to a market-oriented system. Primary care trusts and strategic health authorities were abolished and money was put into a new entity called clinical commissioning groups. GPs still had major roles and were partly running these entities. This led to a more top-down approach in the NHS. Around 2018-2019, the policy of competition in the NHS was abolished, and integrated systems were created across England by 2021. The NHS looked towards integrated US models such as Geisinger Health System, Kaiser Permanente, and the Cleveland Clinic. Essentially, competition between the hospitals decreased and a more integrated system between doctors and hospitals and providers was created.
Thank you, Fundy. I will now go into country demographics and associated information. The United Kingdom lies in the upper northwest region of Europe, covering close to 242,000 square kilometers. The UK is an accumulation of England, Scotland, Wales, and Northern Ireland. As shown, the majority ethnicity in the United Kingdom is white, followed by other percentages including, but not limited to, Black or African Caribbean, Indian, and Pakistani residents. The UK's religious composition is diverse, with Christianity being the most largely practiced religion, alongside other representing religions seen in Islam and Hinduism. An approximate population of the UK is 67,908,842, and once again, 85% of that amount is seen in England. The migration rate is around 2.5 per 1,000 people, and life expectancy rate is averaged to be at 80.6 years, showing slightly higher expectancy for years lived in females compared to males. The age span across the UK shows greatest presence from 15 to 64 years of age, and the infant mortality rate is 3.8 per 1,000 live births. We will now look at the Beveridge model through the pestle analysis. The UK is under a constitutional monarch with Parliament as the government. They run the healthcare system and are the main collectors in the model, as they collect the taxes from the residents that is put towards financing the system. 2 major bodies that Parliament funds is the Department of Health, who displays the government's control in healthcare, as well as the National Health Service, which encompasses the public healthcare system. Economically, it is important to highlight the unemployment rate at 3.57%, showing a declining trend. The NHS spending shows steady increase despite increasing efforts to reduce costs and spending in healthcare. The UK ranks 16th in OECD reports, with around 12% of the GDP spent on healthcare, a general increase compared to previous years. Socially, a significant element is the rising population of elderly residents. The aging population, making up a larger portion, places new challenges on the healthcare system with an increased sense of demand and expectancy. Patient satisfaction is something to also highlight, as only 2/3 of the population is seemingly satisfied with the health system, while 1/3 believes major change needs to happen. From a technical standpoint, the UK has increased their technology integration in healthcare, showing major investments into telemedicine and goals to increase electronic health records usage. Considerable funding for some healthcare technology can be attributed to clinical commissioning groups. The legal side of the UK is primarily held by the Supreme Court. Regulators in the healthcare system are major players, with one being the National Institute for Health and Clinical Excellence, as they create treatment guidelines, ensure compliancy, and grant pharmaceutical approval. The Care Quality Commissioner is another regulator, as all providers need to be registered under the CQC, and this group also handles patient complaints and issues. Environmentally, the UK looks to continue to decrease greenhouse gas emission rates. Flooding has been an increasing issue and risk to residents alongside high air pollution rates, both of which are hurting the health and well-being of the population. Non-communicable diseases make up a considerable portion of disease burden in the UK, with cardiovascular disease as a leading contributor. CVD encompasses a wide range of health complications, including coronary heart disease. Each year, coronary heart disease takes the lives of 1 in every 8 men and 1 of every 14 women in the UK, with 26,000 of those deaths occurring in individuals younger than 75. With 7.6 million people in the UK living with a heart or circulatory disease, it stands to be a primary health issue. Another burden disease is seen in cancer prevalence. 288,733 people died in 2021 from cancer, and that is a statistic only from England. There is approximately 375,000 new cancer cases per year. A third burden disease for the UK is seen in mental health disorders. In 2023, a fifth of the population within the ages of 8 to 16 had a mental health disorder. The Talking Therapies for Anxiety and Depression is a program offered to those in need. Data from 2022 and 2023 showed 1.22 million England individuals using this program, and only a little over half completed the entirety of it. I will now hand it over to Olivia, who will go into the structure and governance of the Beveridge Health Model.
Thank you, Jennifer. In terms of key entities governing the health system, the National Health Service, also known as the NHS, is a public health service under government administration that aims to provide universal health coverage. Each country within the UK has their own departments of health that differ in terms of organizational structure and delivery of services. However, they are all based on the English system. NHS in England is responsible for generating long-term nationwide policies that will be implemented across the UK. They also fund for services and innovations, which includes funding and owning hospitals and hiring healthcare staff. This funding comes primarily from the taxpayers as well as the National Insurance Fund. They aim to do all of this while promoting their key values of honesty, openness, and transparency. The healthcare system in the UK follows a single-payer structure, meaning that the government is able to keep costs low given that there are no other competitors or purchasers. Every taxpayer is guaranteed the same access to healthcare and promises of no out-of-pocket payments. This is due to the fact that the government is responsible for funding all services upfront with money from the tax deductions and national insurance. The government also employs healthcare staff. However, there are private doctors that are signed under a National General Medical Services contract with the NHS. This allows them to collect payment for their services. Under this contract, they are expected to perform additional services such as cancer screening or vaccinations and immunizations. If a private doctor were to abstain from these services, they would have a portion of their global payment withheld. Hospitals have been under public ownership since the establishment of the NHS in 1948. These hospitals are either organized under an NHS trust, which is accountable to the Department of Health, or as a foundation trust, which is regulated by Monitor, a government agency that regulates public and private providers. Foundation trusts are not under the direct control of the Department of Health, which means they have more freedom to make strategic and financial decisions. However, foundation trusts are still required to uphold the core principle of NHS without the safety net of the government to financially cover any shortfalls. Another item of note is that there are lower levels of doctors and nurses, hospital beds, and diagnostic equipment in the UK compared to other high-income countries. From a social justice perspective, the NHS's bottom line is that health is a human right. When first created in 1948, the NHS followed the three core beliefs that healthcare services should meet the needs of everyone, be free at the point of delivery, and be based on clinical need rather than the ability to pay. They also aim to provide high quality and professional services while putting patients at the heart of everything they do. The NHS also works across organizational boundaries and partners with other organizations in the interest of patients, local communities, and the overall population. They are committed to providing the best value for taxpayers' money and the most effective, fair, and sustainable use of their resources. They do all of this while being held accountable to the public, communities, and patients that they serve. And now I'll pass it off to Mary, who will go further in depth about the coverage.
Thank you for that information. Let's talk about health system coverage. The National Health Service cares for more than 64 million people in the United Kingdom and 54.3 million in England. There is 100% public health insurance coverage, which is automatically free public health care through the National Health Service. In England, approximately 10.5% of citizens opt into private coverage for faster access to health care and elective services. The majority of NHS funding comes from general taxes, and a smaller proportion, about 20%, comes from national insurance. National insurance is a payroll tax paid by employees and employers. The NHS also receives income from co-payments and people using the NHS services as private patients. As far as cost sharing and out-of-pocket spending, the NHS has very limited cost sharing arrangements for publicly covered services. Services are free at the point of use for outpatient and inpatient hospital services. Let's look at the coverage breakdown. Primary care here is known as general practice. Residents of England who are eligible for healthcare are required to register with a GP. Services with a GP include acute illness and injury, terminally ill patients, and management of chronic diseases. Additional services provided are contraceptives, vaccinations, and maternal care. Residents typically have their choice of GP, but may be limited because GPs reach their patient limits and stop accepting new patients. For ambulatory care, urgent care clinics are available for minor illnesses and injuries. For specialty care, most outpatient specialist consultations are carried out in hospitals while a small proportion occur in a GP. Patients are able to choose which hospital to visit, and the government has introduced the right to choose a particular specialist within a hospital. For diagnostic services, the NHS has a long-term plan to increase the range of digital health tools and services. People will be able to seek health information and support online and choose whether they speak to a doctor on the phone or in person. The COVID-19 pandemic revealed inadequacies in the NHS diagnostic services. For prescription medications, outpatient prescription drugs are subject to co-payment of around £8 or $12. For inpatient care, you'll normally need a GP referral to access hospital treatment, except in the case of emergency. Hospital treatment is free if you are a resident in the UK. For long-term care, the NHS will pay for long-term care at home or in residential facilities for people with care needs arising from illness, disability, or accident, including at the end of life. About 135,000 people are receiving this form of care in the end of 2018. For mental health services, this is an integral part of the NHS and covers a full range of services. Less serious illnesses, such as mild depressive and anxiety, are usually treated by your GP. Those requiring more advanced treatment, including inpatient care, are treated by Specialist Mental Health Trust. Thank you.
Thank you very much. We will now discuss the health system performance of the NHS. We'll start with the experience of the NHS and then discuss the components of quality, cost, access, and equity. Regarding the experience, the most important thing is that the people in Great Britain are very proud of the NHS system. We've seen that around to COVID, where they were appreciative of all the COVID care, but also on how quickly they were able to develop vaccinations. When we look at the system, there's a difference between the public and the private. Interestingly, the same physicians often work in the public and the private system, and people can choose whether to access them in the public or private environments. The difference is often that people have to wait, sometimes up to months, to be seen in the public system by a certain doctor, while they can be seen 1 week later by the same doctor in a private setting. There's definitely frustrations among physicians in the NHS. They feel their salary is too low and they sometimes work slowly in the public system and tell people if you want to be helped quicker or want your surgery not after a few months but earlier, you should come see me in the private system tomorrow. There's also sometimes talked about an efflux of physicians going abroad for a higher pay, especially to the United States. And there's increasing immigration of physicians to replace a lot of the physicians, which is not always perceived as positive. Finally, I would really recommend the book This Is Going to Hurt by Adam Kay. The book is written by a young OBGYN registrar, which is a resident in the NHS, and he has a lot of humor and talks about that every day he goes to work and his parking meter has a higher hourly wage than he does. Regarding quality of the NHS generally in all the rankings does fairly well, with a ranking around the 30th spot, which sounds great, but it's not great when you look at the national GDP of the United Kingdom. And I think they could do better. Looking at healthcare innovation, they're ranked in the top 15, but again, not in the top 5 or top 10. And that's something we keep seeing all the time. So overall, they're doing fairly well, but not as well as you would expect. Regarding costs, they are doing very well. They have a good control of the cost, and their costs average around 12% of the GDP, which is much lower than, for example, the United States. Looking at the modes that they can control the cost, one is the salary of the physicians, as we just discussed, but also to control expensive innovation. It can be hard when you have a rare disease and you want a very expensive treatment. It can be hard to get this reimbursed by the NHS. And the infrastructure is definitely considered old. And the book by Reed from this week talks about this, where the walls look like they haven't been painted since World War II. They also have the NICE, which is the National Institute for Health and Care Excellence. And what they do there is they assess what the added value of certain treatments is and whether it should be covered by the NHS. Regarding access, they do very well as well. There's access for everyone. There's great access for urgent care, emergency room care, etc. Although sometimes there's difficulty to getting quick access, as we discussed in the public system. Regarding equity, we see that there's definitely some disparities, for example, when looking at urban versus rural areas, as we see in this JAMA network paper, looking at 11 high-income countries, and they show that the United Kingdom definitely has some of the disparities in the different domains. Looking at disparity on income, the United Kingdom does fairly well. There's almost no difference in high income versus low income people getting access to treatment, satisfaction with their doctor visits, and the confidence of getting the best treatment. The only difference is that low income people generally have poorer health than high income people, but this also likely has to do with behavior such as smoking and food, and I think it's a global pattern and not something per se related to the NHS. Overall, the NHS has a good health performance. They're behind countries such as countries in Scandinavia or in Central Europe, but overall on par with other countries such as the United States or Canada. They have a lot of positives with this healthcare system, such as excellent access, low disparities, low or acceptable costs, and people that are very proud of their system, which is important as well. But there are drawbacks. They're not superb, maybe not even as superb as you would expect by their GDP. The cost control is through wages, which makes physicians not always happy about the system and nurses. And it's sometimes difficult to get innovations implemented. I will now hand it over to Paiman to discuss innovation and excellence.
Thank you. Innovations. We are looking into how Beveridge system, where healthcare is funded by the government, is using new technology to improve care. We'll see the benefits of this tech and some tough spots in making it work for everyone. Digital health technologies. The NHS is bringing all patients' information together, an electronic health record, or EHRs. This helps doctors treat patients better. However, it's tough to keep this data safe and get different parts of the NHS to share it smoothly, especially with older systems not working well together. Telehealth services. Telehealth let patients consult with doctors, which was especially useful during pandemic. But there is the issue of making sure everyone can use these services, considering not everyone is tech savvy or has reliable internet access. AI and machine learning. AI is changing the game in diagnosing disease faster and planning better treatment in the NHS. The main problem are training AI with enough data, ensuring to apply ethical and moral in AI decision, and protecting patients' privacy. Remote monitoring and wearables. Devices like a smartwatch help patients keep track of their health, fitting the NHS goal to let people manage their health outside hospitals. This can lead to fewer hospital visits and better chronic condition management. Introducing to Huma. Huma is a company that partners with the NHS to offer care at home using technology. It's an excellent example of innovation making healthcare more accessible and convenient. Huma Impact. Huma works with NHS in changing how care is delivered, making it possible to more patients to receive care at home. This approach has improved the way patients get help and make care more personalized. Something very interesting about this main innovation, which is Huma, is the founder. The founder is Dan Wahdad, is visionary behind Huma. Once said, innovation in healthcare is not just about technology, it's about changing lives. His journey from Johns Hopkins University to founding Europe's fastest growing healthcare economy showcases how education and innovation can drive global healthcare transportation. Dan Wahdad was graduated in biotechnology from Johns Hopkins University, and he is a startup in innovations in UK NHS health system, is one of the unicorn company right now and has the value over $1 billion. Conclusion. Introducing technology like Huma into NHS is reshaping healthcare for the better. Through these all changes, the potential for improving care for everyone is significant. It's an exciting time as we explore new ways to provide healthcare across the UK. Thank you.
As you have now learned from our team, that NHS is a developed healthcare system. However, the UK does face some challenges with this. Firstly, limited resources pose a significant obstacle to delivering optimal healthcare to the growing population. NHS healthcare providers work tirelessly, but they are often stretched thin due to budget constraints and staffing shortages. Along with this, there is outdated infrastructure and technology due to the limited funding. Although the NHS aims to provide universal healthcare to all, there can still be accessibility issues. Much like other healthcare systems, there are regional disparities that occasionally will impact the quality of care. There also tends to be longer waiting times, which may disproportionately affect certain groups and cultures. Lastly, specialized healthcare presents its own set of challenges. While these services are vital for many patients, accessing them can be complex and very time-consuming, leading to delays in overall treatment. The NHS controls its budget by controlling the range of tests, medications, and procedures. This, in turn, has most impact on chronic diseases and the aging population. Along with this, people feel as though there's
is lack within the mental health support. The NHS faces significant constraints on innovation and the introduction of new services. As we previously said, one of the major hurdles is funding constraints. The NHS operates within a limited budget, making it challenging to invest in the new technologies and initiatives. Along with this, there is also resistance to change due to regulatory hurdles within the healthcare system, impeding the adoption of innovative practices. The NHS, with its complex bureaucratic system, often struggles to navigate regulatory requirements, slowing down the implementation of innovative solutions. However, despite these challenges, there is a growing recognition of the need for innovative healthcare. Efforts to streamline regulations and increase investment in development are crucial for the overcoming these constraints and ensuring that the NHS can effectively adapt to the evolving needs of the society. Even with those constraints I just talked about, I do want to discuss how the NHS has made significant progress in creating ways to develop new services. In 2016, the Health and Care Act created a framework for improvement in the healthcare system, allowing for innovations such as telehealth to be adopted. This act is continuously updated, and in 2022, after COVID, it was again updated, removing some barriers, enabling for a slightly more streamlined process for new services. The Healthcare Workforce Plan has been created as a plan to create environments for long-term workers and to ensure ability to care for the growing population. The NHS also focuses on prevention. They release informative educational resources to help citizens stay healthy. Along with this, the culture throughout the UK helps by promoting healthy preventative lifestyles, which in return eliminates some needs of the healthcare system, allowing for more efficient care. Going forward, the UK can focus on pharmaceutical investments, such as manufacturing within the country, to help lower costs of drugs on the fund, which in return will allow for greater accessibility for the patients. Telehealth is one of the innovations that the NHS has adopted in recent years that revolutionizes access to care. Patients can connect with healthcare professionals remotely, breaking down any accessibility barriers, and by leveraging telehealth, the NHS enhances efficiency by reducing wait times for appointments and streamlining the overall healthcare process. As well as this, telehealth delivers a significant cost savings for the NHS, optimizing resource utilization and removing excess patients in the office. Thank you so much for watching our presentation. We really hope you enjoyed it, and we look forward to hearing your feedback.